Assalamu alaikum. We are back with our session. Let us move forward with our program. It is very easy to label an individual as mentally unfit. But what is the basis of our accusation? How much do we really know about mental health and illness? It has been narrated in Sahih Bukhari that there is no disease that Allah created except that He created its treatment as well. If there is a problem, there is a solution. So let's turn our attention to Dr. G.Hussein Rassool to correctly understand the problem of mental illness as well as the solutions that we can find to deal with them. A little background on Dr. Rassool himself before we pass the mic to him. Dr. Rassool has a PhD in Psychology and Education from the University of London, an MSc in Health Education and a BA in Psychology. He is currently working as an academic advisor, lecturer in psychology, independent consultation in addiction and mental health, and clinical consultant of Sakina Counseling Institute and Research. Dr. Rassool is the author of 8 books and has published over 100 papers and reviews. Some of his published books are Cultural Competence in Caring for Muslim Patients, Addictive Behaviors, Theory and Clinical Practice, Alcohol and Drug Misuse and Dual Diagnosis, Islamic Counseling and Introduction to the Theory and Practice. His forthcoming publications include Jinn Possession, Evil Eye, and Mental Health. Health Psychology from an Islamic Perspective, based on the Quran and Sunnah, Addictive Behaviors, the Disease and its Cure, and Islamic Perspective. MashaAllah, that list is quite a mouthful. Over to you now, Dr. Rassool.
Jazakallah khair. Can you hear me?
Yes, Dr. Rassool, we can hear you.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الحمد لله رب العالمين والصلاة والسلام على رسوله الكريم وعلى آله وصحبه ومن استنى بسنته يوم الدين. قال ربي اشرح لي صدري ويسر لي أمري. السلام عليكم ورحمة الله وبركاته. Welcome to this session. This session is about an overview of mental health and mental illness. So what I'm trying to do in this session is to provide an agenda setting for the rest of the conference. I'm going to go over some of the main mental health problem or psychiatric disorders which are going to be elaborated in subsequent lectures. Can we have the first slide, please? So when we talk about understanding mental health and mental illness, here we talk about when we have a health problem or mental health problem, it means that affect a person's behavior, thoughts, and emotion. And that can be very scary sometimes because these problems are illnesses that can be often be, of course, successfully treated, just like any other physical problem. However, understanding this illness can make them less mysterious. I think, first of all, one should know that Islam considers all diseases, including psychiatric illness, as trial and tribulation, as trial and test from Allah. So when any disease befalls a Muslim, it can be an expiation for his or her sins. So when the brain is working properly, it responds to life events with normal emotions. However, when the brain responds, this can be changed by illness, and that would affect the balance of, for example, chemicals in the brain. So the brain controls our thought, feeling, memories, and action. So a mental illness, basically, it's a disorder that affects all these functions. Sometimes one or two functions, sometimes all the functions, and become totally incapacitated. There are many myths about mental illness. Some of them, or two of them. First of all, people with mental illness are violent and dangerous. This is what the media portrays. However, this is wrong, because as a group, they're no more violent or aggressive than any other group. In fact, they're more likely to be victim of violence or mistreatment or maltreatment or abuse, than being violent or aggressive themselves. Another myth: people with mental illness are poor or not very intelligent or less intelligent or less capable. Again, this is totally wrong, because many studies have shown that some of them are average or above average intelligence. Mental illness, like physical illness, can affect anyone, regardless of intelligence, social class, status, or income level. So what is mental health? Now, mental health has to do how you feel about yourself. How do you feel about others? And how you're able to meet and handle the demands of life. In fact, it is not the absence of problems. Rather, it tends to describe the ability to balance problems with appropriate, again, positive coping skills. In fact, there's no line which separates mentally healthy from healthy. This is a very, very thin line. But we know that the right amount of sleep, exercise, proper diet, appropriate medical care, or taking one medication can go a long way towards improving both our physical and mental health. For example, we all have, at times, we felt down, stressed, frightened, anxious, a bit paranoid. However, most of the time, these feelings pass away. They go away without any form of treatment. But everyone is different. You may bounce back from a setback, while others may feel the way down and feel bad for a long, long time. So when we talk about good mental health or positive mental health, which means that we make the most of our potential, we cope up with life, or we cope with life in a positive way, or we use positive coping mechanism. And we play a full part in the ummah, the family, the community, the workplace. And this is also called emotional health or wellness or well-being. So we're talking here mental health in terms of it's a level of psychological well-being or an absence of mental disorder. Of course, there are so many definitions, and this is one from the World Health Organization, which define mental health as, quote, a state of well-being in which the individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make contribution to his or her community. So first, we realize our potential. We cope. We use coping or positive coping mechanism to deal with the trial and tribulation or normal stress of life. We are productive, and also we make a contribution to the community. However, when we talk about mental health, but we know that emotional health can also impact on physical health, and poor mental health can lead to problem, to physical problem or problem of addiction. So the importance of maintaining good mental health is crucial to living a long and, inshallah, a healthy life. So good mental health can enhance one's life, while poor mental health can prevent or limit somebody from being productive or from living a normal life. Next slide, please. We talk here, the next slide, in terms of mental illness. So if mental health is being productive, having control, could mental illness from a sociological term is seen as a deviation. You deviated from socially approved standard of interpersonal behavior, or an inability to play your role, to play your social role, to be a father, to be a husband, to be a spouse, to be a wife, to be a teacher, whatever it is. So you are sanctioned in a way to play that role in life. And in social science literature, it's generally agreed that mental illness refers to something dysfunctional. So you have a dysfunctional interpersonal behavior, judged to be dysfunctional in terms of norms and values held by the observer. So in terms of your community, there's a deviancy, there's dysfunctional in terms of the values. Well, mental disorders are any illness with psychological or behavioral manifestation, because we talk about how when we have problems with brain function, it affects all these functions, our thinking, our thought, our behavior, our feelings, and that is associated with either painful or distressing. Or sometimes we have impairment of one or more of these important areas. Right, this is a verse from Surah Nisa. Interpretation of meaning, I'm just reading the English part. And do not give the weak-minded your property, which Allah has made a means of sustenance for you, but provide them with it and clothe them and speak to them words of appropriate kindness. This is from Surah Nisa, Surah 4, verse 5. Now, this is, if you look at the tafsir of Ibn Kathir, talk about here, Allah prohibited giving the unwise the freedom to do as they wish with wealth, which Allah has made as a means of support for people. In fact, this ruling sometimes applied because of being young or as young people, or those incapable of making wise decisions. It also applies in case of insanity. So people insane, people have psychological problems or mental health problems, erratic behavior, or having a weak intellect or religious practice. So although this generally applies to children and women, it also applies to those who have in cases of insanity. However, from Surah Yusuf, Surah 12, verse 8-7, interpretation of meaning, Allah said, and despair not of relief from Allah. Indeed, no one despairs of relief from Allah except these disbelieving people. So we shouldn't despair from Allah's mercy. He ordered us never to give hope, or we should never give hope in Allah, nor to ever discontinue trusting in Him for what we seek to accomplish. So in fact, this is Prophet Jacob ﷺ addressing to the brothers of Yusuf. But if you apply it to us, that we shouldn't despair, because there's relief from Allah, there's mercy from Allah. We should always have hope, not we should have fear, but hope in Allah, and we trust in Allah and tawakkul Allah. So mental illness, all disease in a way are trial and test from Allah. Well, we know that sins are forgiven. In fact, one of the hadith from Prophet ﷺ, narrated by Imam Bukhari, Prophet Muhammad said, there's no disease that Allah has created except He has also created its remedy. And Usama ibn Shuraik narrated, O Allah Messenger, should we seek medical treatment for our illness? He replied, yes, should seek medical treatment, because Allah the Exalted has let no disease exist without providing for its cure, except for one ailment, namely old age. This is narrated by Tirmidhi. So in a way, we need to seek treatment, even if it's to do with psychiatric or mental health problem. Another hadith, this is, next slide please. Yeah, hadith, this is related to our deeds. In fact, only 3 people from this hadith So about only 3 people would have the pen stop writing their deeds, whether good or bad. A sleeping person, he'll wake up, a child until they reach puberty, and somebody who is insane. Now, what's the problem? What's the extent of the problem? So here we're talking about evidence from the World Health Organization. Nearly half of the world population are affected by mental illness. So that's quite significant, which have an impact on the relationship, their ability to function, their ability to produce, their ability to have a family, or having problems generally with self-esteem. So in fact, if we take 600 people attending this conference, or even 500, roughly about 120 of them would have had some form of mental health problem, mostly probably minor problems such as neurosis, and a small group of people will probably get some sort of what we call psychosis or psychotic disorder. So 1 in 4 people has mental illness. These are some examples of mental illness. Okay, we're not going to be proficient in all of them, but at least we would be able to have an awareness that these problems exist, and they are some of the symptoms we'll be able to maybe recognize and also provide the appropriate help to people. So there are different types of mental health problems. Some of them are very common, like depression and anxiety, and some are not common. For example, schizophrenic, or some people with bipolar disorders. This is again same thing, but dividing mental disorders in terms of severity of it. Some common mental disorders, in other words, we can call them neurosis, or severe mental disorders, where we can call them psychosis in psychological terms. So, and these are just show you sort of the categorization of mental disorders. Right. This is we have something called DSM, which is Diagnosis Statute. It's a manual. It's a manual by the American Psychiatric Association, and at the moment we have the 5th one, because it gets upgraded now and then. Because why? Because there are different set of problems and different type of illness or different disorders, and these are placed in the manual so that doctors, psychiatrists can diagnose them. We have the 5th one. Now this one here is basically why I put that, just to show you that there are different new disorders that they have included in the new manual. Of course, gambling disorder and so on. But what's missing there is, for example, they still have not agreed about internet disorder or disorder of technological disorder. This has not been included in the new. But these are some of the new. For example, hoarding disorder. That's quite new. And skin picking, where people are so compulsive that they start picking their skin or scratching all the time. Again, this is purely what we call psychosomatic disorders, and it comes under obsessive compulsive disorders. Just to show you about that, disorders, they're not static. Every now and then there are new disorders, and these are included in this particular manual. Right, let's move on to the next slide, please. Now, mental illness begin in childhood. Some of them, not all of them, and some of them persist in adolescence. For example, some of them, like we have attention deficit hyperactivity disorder, or autism, or we call it autism spectrum disorder, because it's quite autism spectrum is an umbrella for a number of types of autistic problems. Or we have what we call general anxiety disorder. But some of them, next slide, some of these problems also happen during adolescence. Or during, if you look at eating disorders, for example, among young girls, usually 13, 14, or even up to 9 years. Basically, during that sort of time of menstrual period, you find a lot of them have problem with either bulimia or anorexia or binge eating. Or you have schizophrenia as well. So you have sometimes a young person just going to university and start developing psychotic disorder and so forth. So these are the major mental health problem that can happen during adolescence. Or sometimes they often begin, during the adolescent phase. Addiction also should be included in that, which it is. Now, one of the problems we face in our community, and this is not only our community, but generally outside as well, is stigma. That there's a stigma attached to having a psychotic problem. From my experience working, in Brazil, in Europe, and in Far East, and Southern Africa, what I found is that most Muslims would rather say they have a jinn possession than saying that they have a mental health problem. This is universal, whether it's in street of London or street of Durban or in Chicago, whatever it is, they have the same. Because again, possession or having evil eye are acceptable within the Ummah, whereas having a psychiatric problem is not acceptable, or is regarded as somebody being mad, somebody should be locked in an asylum or whatever. So stigma causes a big problem in our community as well. So it is still seen as an indulgence or a sign of weakness. Yeah. In fact, in our community, sometimes shame overrides even the most extreme of symptoms. What is the impact of stigma? What does it do? It isolates people. The lack of social interaction. There is rejection, hostility, even violence. People are socially excluded, marginalized. They face discrimination, not only at work, but within the family itself, or restrict a person to develop their own potential. And also, it acts negatively on a number of other factors. Let's look at some of the common type of mental health problem. We'll be speaking to a few minutes. Next slide, please. Next slide, yeah. And the next one. I'm going to just speak a few minutes on each of these disorders. Let's start with attention deficit hyperactive disorder. This is a brain disorder. It's marked by an ongoing pattern of inattention or hyperactivity, impulsivity that interfere with functioning or development. It happens with children. They have problems with inattention. So, for example, the child would wander off task. They lack persistence. They have difficulty in remaining focused, disorganized. Or they're hyperactive. They move about constantly, including situation which is appropriate or not appropriate. Excessively, they fidget, they taps or talks. In fact, in adults, it may be extreme restlessness or wearing others out with their activity. But also the third criteria, they are impulsive. Impulsivity, which means that it makes a child or adult in some cases make hasty action that occurs in the moment without thinking about them, or they may have high potential for harm, or a desire for immediate reward, or inability to delay gratification. They see the reward immediately, they cannot delay gratification. So an impulsive person may be socially intrusive, yeah, and excessively interrupt others, or make important decisions without thinking of long-term consequences. And this is attention deficit hyperactive disorder. Next one, please. Please, yeah, anxiety disorders, again, it's an umbrella, it's covers all sorts of things, panic disorder, people obsessional disorder, we'll come back to that in a minute, phobia and post-traumatic disorder, which I'm going to talk about, inshallah, tomorrow. So anxiety, constant, people are concerned and realistic worry about it. I mean, we all worry about things, we're all anxious about things, but it's good sometimes if you have a bit of anxiety, it's good for motivation. Too much anxiety interferes with our life, we can't do anything, And sometimes we feel restless or sleeping problem or our heart increase, heart rate increase, stomach upset, we're feeling shaky, we have tension in the muscle, some people have paralysis, some people have panic attacks. They have panic attack in such a way that they want to go and see what in the casualty department to see, they think they are having a heart attack. But when you do electrocardiogram with them, you do a test with them, you find that they have nothing, there's nothing heart attack, it's purely to do with panic attack. Next slide, please. Now we come to Alzheimer, which is a type of dementia, and in fact we should think of Alzheimer. It's not part of normal aging. Not because we age, we're going to have Alzheimer. No, but Alzheimer is not part of aging. It increased age is the most common cause, but increasing age is the most common cause. And it's worsened over time. Unfortunately, there's no cure for it, but treatment of symptoms are available and research continues. Again, it affects people's memory. We all have experience of somebody in our family where people, their long-term memory is intact, so they would be able to tell you in 1945 what exactly they did, but they couldn't tell you what they had for breakfast, because the short-term memory is affected, is damaged, whereas the long-term memory is intact. But they have problems, they're confused, memory problem, thinking problem, behavior problem. They repeat the same thing, and it may be difficult sometimes unless you understand that these people are going through a bad time. It's bad for them because they have pride, but they know that's what's going on. They still, have some. The brain is not totally damaged, but at the same time, they can't help, being what they are. Some people have what we call bipolar disorders. So either they are depressed or they get very manic, either depressed or very overactive. And so they have extreme swing in moods. We call it mania. Overactive, excited behavior, euphoria. There's nothing in the world that can do anything to them. Sometimes they can't be, after that, they go back to a depression. They start hearing voices or seeing things. They have hallucination. They have delusion, false belief. And they have those delusions. They think other people don't share, and they are abnormal for them in their context. And these, they have what we call people with mood swing. They have what we call bipolar disorder. At times they're overactive, at times they get depressed. And these mood swing from one to another. You can't have both at the same time, can only have one at a time. Next slide, please. Depression is very common. The most common mental disorder. We don't get depressed, but we don't get clinical depression. But when we get clinical depression, we lose interest, pleasure, feel guilty. We don't like our body. We have low self-esteem, low self-worth. We can't sleep properly. We lose weight, we have allergy, we have poor concentration. In fact, we don't want to do anything basically, especially waking up in the morning. Early morning feeling is that, oh my God, I have to, it's another day. I have to, to go through, and this is bad in the morning. But as the day goes on, they're depressive. The mood seems to change. They get better, and then they can't sleep. And the same vicious cycle happens. So depression lowers your mood. You feel hopeless, worthless, unmotivated. And affect your libido, your self-esteem, you're tearful, mild. The danger with depression, that from a sort of psychological point of view, all depressed patients are potentially suicidal risks. What I mean by that is that people with depression, they have a potential for suicidal risk. And we are, especially when we what we call smiling depression, when we think people are getting better. Although it doesn't happen in Muslim because all sorts of reasons we won't go into, but generally in the general population, we find when people are getting better from depression, when they have more strength, this is where they're more likely to commit suicide. There's a lot of evidence for it. Okay, the next one we come to, in fact, when we talk about suicide, 850,000 lives every year are lost through suicide, according to the World Health Organization. Okay, eating disorders. I'm just a bit back. We talk about it. Disorders happen during adolescence, affect more female than male, although they are male anorexic. They are, strange, but mostly female, mostly young girls, mostly going to university, very intelligent girls, and where again they probably in terms of stone, I don't know about kilos, but about 6-7 stones, and so you have either anorexia or you have bulimia. So anorexia is you have there's a fear, there's a phobia about weight, gaining weight. Whereas bulimia is different. Bulimia people eat, chocolate, whatever it is, and stuff themselves and then vomit everything, or you laxative to do that. And then you have the other type is the binge eating disorder, where people binge anyway, all the time. Again, it's a very sometimes difficult problems which happen with adolescents, and sometimes these eating disorders, which mean there's sometimes dysfunctional family or disguising emotional pain, and it in fact affect 1 in 20 women or young girls, I should say. Okay, let's move on. This is going to be covered as well in full. Next slide, please. We come to psychotic disorders, what is known as schizophrenia. So it is a chronic disease, severe brain problem. It affects your thought, your feeling, your behavior. Because people hearing voices or seeing things, hallucination, or again they have false belief, what we call delusion. These they cannot share with other people. They have confusion of thought. They're withdrawn. They're suspicious of others. They become the different type of schizophrenia, of course. Some of them are what we call paranoid schizophrenia. They feel people are going to poison them. People are going to kill them. In fact, in some cases, it's true. It happened in a few cases where they didn't suffer from schizophrenia, but people were ready. In most cases, people have those paranoid feelings, and up to 4% of population hear voices, and most of them have no problem. Again, here we're not talking about jinn, we're talking purely psychiatric disorder. Next slide, please. Obsession. It's a bit quite a lot in that slide. It's about thought, about ideas, our belief. It's like things that goes on in our head all the time. We go to sleep and we have the same thought keep running around in our thought. We can't sleep. It disturbs us. Physically we'll be tired, but those thoughts, and those thoughts, can to do with contamination or harm or doubt, or we think we have certain disease as well. Whereas when we talk about the next slide, I'm moving on a bit quick. When we talk about compulsion are repetitive acts. And so we turn our obsession into behavioral problem in terms of repetitive acts. We start having rituals. And these rituals, in fact, we are repeating, checking, cleaning, avoid. For example, we done wudu, and then we find out that, have we done that? I've washed my hand, we do it again. Again, Shaitan is playing about with you. It's a bit washwasha here as well, anyway. So Shaitan is playing with you, and you start, repeating, checking, double. I mean, it's of course, it's good to check things anyway, do it once. But if you check about 4 or 5 times, or if you feel that you're contaminated, you have to have a shower every 5 minutes, then there's a problem. And this is where our thought, translate into some form of our obsession, translate into our compulsions. Oh, I have to control that. Hang on. it's call for prayer here. Anyway, right. So we talk about so we have obsession, which is the thought, and compulsion, which are the ritual and the act. We're going to look at addiction in terms of it's a habit pattern that increases the risk for disease associated with all sorts of personal, problems. But addiction is not only pharmacological. It's not to do with drug and alcohol, because we can be addicted to internet, to food, to sex, to shopping, gambling, to work, to activity, all sorts of things we can be addicted. So we can divide addiction in terms of pharmacology, in terms of drug, alcohol, tobacco, and we have the other non-pharmacological addiction, which include gambling disorders, eating disorders come into it as well, internet disorders, work, sex addiction, and so forth. Inshallah, tomorrow I'm going to talk about this, but just this is another type of disorder. It's a mental health condition that is triggered by some trauma, by some terrifying events. You are experiencing or you have witnessed it. So the symptoms may include what called flashback, people reliving that nightmare all the time, or severe anxiety. As well, you have all these obsession, all these uncontrollable thoughts about the particular event. Now, we know how Islam plays an important role in helping Muslims to cope with life events, negative life events, which help them in both sometimes prevention and treatment of depression. Of course, we're not superhuman, and if one experiences negative feeling, in fact, you're encouraged to resist them with positive thought and action. And if possible, if you can't do that, then you seek professional help. If the case is clinical, exactly like you would go if you have a physical problem. And this is Surah Arash, Surah 94 verses 5 and 6. Allah said, interpretation of meeting, for indeed with hardship will be ease, indeed with hardship will be ease. Which means Islam encourages us to be hopeful, that after difficulty, there will be ease. So even if someone has committed the worst sin or faced with the most troublesome life event, there's always God mercy. There's always Allah mercy. But we have a tool. We have dua, which we can make. The next slide, please. Which we can. Right, we can move on. The next one. This is from Al-Talaq, the divorce, Surah 65, verses 2 and 3. Here, interpretation means, I say, whoever fears Allah, we will make for him a way. So there's always a way out. Yeah? If we have taqwa, we fear Allah, and we supplicate. Yeah? And number 3, you see, Allah said, and He will provide for him from wherever he doesn't expect, and whoever relies upon Allah, then He is sufficient for him. Indeed, Allah will accomplish His purpose. Allah has already said for everything a decreed extent. So we have to trust in Allah. We have to fear Allah. He will make a way out for us. Again, we have a tool in our hand. If we suffer from, psychiatric problems, psychological problem rather than psychiatric problem, then there's a dua which you could make. The next slide, please. Sometimes you can ask dua for health. You say 3 times, oh Allah, make my body healthy, make my hearing healthy, make my eyesight healthy. Then it's not going perfectly. And this is from Sunan Abu Dawud. This is an my session. Subhanakallahumma wa bihamdika ashhadu an la ilaha illa anta astaghfiruka wa atubu ilayk. Assalamu alaikum wa rahmatullahi wa barakatuh. I think we can take some questions if I'm correct.
Yes, that was very informative, Dr. Rassool. I'm sure many of us will benefit from this important information that you have provided us on mental illnesses. We will now take a few questions from our audience. You can please type your question in the chat box and we'll take a few questions for Dr. Rassool.
Is the thing being typed because I can't see anything?
How to know that one is suffering from mental illness? How can we deal with them? This is
Right.
from Sister Fatima.
Yeah, okay, yes, okay, thank you. We all have what we call a baseline behavior, which means that, we may be obsessed, we may be anxious. A bit of obsession is good for you if you're tidy and things like that. Okay, so we have a baseline behavior. But if that behavior is going to interfere in our life, in our work, creating problem in family, then we have a problem. So it becomes a problem when we start malfunctioning. Okay? So in the sense that, you know your behavior, because sometimes it's good to, if you're a counselor, you always want to find out what the person was like before they developed that particular problem. So you want to know, to go back, how was it like when he was a child? So you have some sort of sense of the type of behavior they presented when they were well, yeah, inverted commas. So once you deviated from the wellness, once you have no control over your thought, feeling, behavior, then you have the problems, then you should seek professional help.
All right, next question is from Brother Ilyas. He says, Assalamu alaikum, doctor. It is stated in the Quran that there is a cure for every illness. It is actually a hadith that we had narrated from at the beginning. However, why are there still no cure for some illnesses today? This is his question.
Yeah, I think, walaikum salam. Perhaps because we don't, for my opinion, we don't have that knowledge yet. Because every time you read the Quran, yeah, you find something new. Yeah, a lot of research that's coming out now, which the Quran stated, 1400 years ago. So in a way, yes, there's no cure, but maybe because we don't have that knowledge. It's very difficult to understand. We don't have that capacity. Our brain doesn't have that capacity yet to be able, to solve everything. And, again, sometimes possibly because of political reason or other reasons, financial reason, we don't focus on certain disease, and also there's a limit of, business, people would pour money into treatment or pharmacology because there's money in it. Yeah. Not because they want to cure people, for example, when HIV came along and so forth, they were the treatment. They were expensive. In fact, you find Brazil and India start producing their own drugs, yeah, so which was cheaper, and the pharmaceutical company didn't like it because they wanted to make money. So there was also a reason why first of all, we don't have the capacity, our brain is not developed, and also people are not putting or focusing on certain research, which maybe because there's no money, business-wise. This is my opinion.
Okay, Jazakallah khair. This is a question from Brother Muhammad. He asks, is OCD, obsessive compulsive disorder, is it curable?
Yes, it depends. Yeah, of course it is. Yeah, because as a Muslim, we always have hope. Yeah, and we have to trust in Allah as well, because the Hadith said, but you need to seek treatment very early on, and so whether you do ruqya, sometimes. Again, it's sometimes to do with shaitan as well. Yeah, so it's not all psychiatric as well. Sometimes washwasha anyway, obsessional thought and so forth, and so yes, it can. With therapy, with behavior therapy and cognitive behavior therapy, you can do that. Yeah, because these minor, what we call neuroses, these can be easily treated with psychological intervention, and there's a lot of evidence for that.
All right. This is a question from Sister Zainuddin. She asks, Assalamu alaikum. How can one deal with being nervous at all the time?
Wa alaikum salam. But a bit of nervousness is good for you, because if you're a bit anxious, you're going to be more productive. So anxiety is good because it makes you what we call fight and flight reaction, which means you're ready to respond to things. So yes, now if you worry for every little thing that happens, then this is a problem. So again, one need to assess the level of worry. Does the worry you have interfere in your day-to-day living? If it's not, for me, it's not a problem. Unless it's creating problem for other people as well, then it becomes a problem. Okay? So it may not be a problem for you, but if it's affecting, it's impinging on other people's life, then one need to do something about it.
All right. This is actually more of a comment, but it will be good if you can discuss it, Dr. Rassool. Sister Uzma says, most places you mentioned that women are the ones with mental illnesses and not men. This is kind of male chauvinistic. I myself know of men who binge eat and have mental illnesses.
No, I said the majority. This is the, maybe I probably communicate this. The World Health Organization, which mentioned that in terms of anorexia, I mentioned, and bulimia, mostly women. I've come across one or two men, but they're very few. Binge eating, this is a different matter. This is, you can't say this only affect males. But generally, if you look at the statistics worldwide, it's female tend to have more problems, psychological problems than men. Although this is not because men have less problem, it's because sometimes they don't open up, they deny the problem until it becomes chronic. So if I did say that, I do apologize. I don't mean to be chauvinistic about it, but no, it affects everybody, whether you're male or female. But in certain cases, eating disorders, it's majority are female.
That's quite reasonable enough, Dr. Rassool. Jazakallah khair. One more question. This is from Sister Mahmouda. She says, could people develop mental illness during a stressful period of their life?
Sure. Because the stress itself leads to anxiety. The anxiety leads to maybe panic attack or depression. So yes, simple stress would lead to that. Depend, you can have simple stress or chronic stress. It depends on the level of it. Yeah, it would be okay. It lead to depression. It lead to anxiety states. Yeah, when again there's tomorrow, I think maybe later on or tomorrow or this evening, we're going to look at Sister Bella is going to look at anxiety and stress. So you find that it leads to different psychological problems.
All right, Jazakallah khair, I think. And there's a question, but she has not typed in completely. If there are any more questions, please type in quickly. We can, I think, take a few more. This is a question from Brother Rashid. How can we tell between jinn and physiological disorders, psychological disorders?
Sometimes very difficult because the symptoms, in Solace 1 conference, I did a talk on it, on mental health and jinn possession. It's difficult sometimes because some of the symptoms are very similar. But then there are some signs. For example, people hearing the Quran or can't read the Quran or whatever it is, people are affected by it. I mean, you could do tests, to tell whether it's to do with evil eye or jinn possession or what. But sometimes it's very, very difficult to I mean, somebody a layperson is going to find it very difficult. While somebody who does ruqya, an imam, or a psychologist, a clinical psychologist, or a psychiatrist, be able to, some of them won't be able to tell anyway. They think it's psychiatric disorders, but because the symptoms are very similar. Most of the symptoms are similar.
All right. Next question is from Niyaz Ahmed. He asks, for ADHD, we say the problem is in keeping focus. but I think shaitan brings distraction, like the things that we think in prayer, we have doubts. Similarly, shaitan can do distraction in all parts of our life, work and study. But why does still ADHD exist? I think he's trying to understand the difference between ADHD and the distractions from shaitan.
Yeah, okay, because ADHD is we talk about it as being affecting somebody. It's a brain disorder, full stop. Yeah, and so it's something to do with the brain, and there's an organic problem there, and because of that, it affects more children than adults, or do adults who have this as well. And they, like I said, they have this problem of inattention, hyperactivity, or sometimes impulsive. And no, I don't have any answer for that either. Why they do, but this is what it is.
All right, we have a question from Sister Sahra. She says, how do you know if something is obsession or addiction or neither of these?
Well, obsession, like I said, it's good to be obsessed sometimes, because if you're obsessed with cleaning, it's good, but sometimes, if you clean all day long, and then there's a problem. Now, addiction is different, because although in addiction there's compulsive behavior, which I'm going to look at addiction in the third day of the conference, so we can talk about that. So one of the elements of addiction is compulsion, is compulsive behavior, which means that the person need to have that drug, the person need to have that activity in the gym every day, the person need to have that chocolate, because they get addicted with chocolate addiction. There's compulsion there. Once we withdraw that compulsion, they can't get it, they become aggressive. And this is where sometimes people get withdrawal, because it's amazing. We can get withdrawal with coffee, and we can get withdrawal with tea. Other people don't realize that. So we get withdrawal with alcohol and any other illicit prescribed drug or illicit drugs. So there's a difference again between, although there's element compulsion in addiction, but compulsive behavior, obsessional is very different from addiction.
All right. We have a question from Sister Farzana. Can I go ahead, Dr. Rassool?
Yes, please.
Yes, we have a question from Sister Farzana. She asked, my mother feels a kind of pain which is very severe, but no doctor has been able to identify it. So we are giving her psychiatric treatment, but she's not improving. How can I help her?
Yeah, you see, the thing about Muslim, or not necessarily Muslim, but Asian, generalizing a bit there, sometimes we tend to express our psychological symptoms into physical signs. Yeah, so we can, for some reason, I don't know myself, but the way we present symptoms sometimes is physical, but in fact, it's psychological in origin. Yeah, so the way we would say that we have pain in our leg, but possibly it's nothing to do with our leg, because when you do tests and you find out they're all right, but it's to do with, we convert. It's like a conversion. We convert the psychological problem into something physical. Yes, of course, it's like maybe you need Europia as well. You don't know. In fact, if I'm correct, Sheikh Uthaymeen mentioned that people, if they have problem like that, they should not only seek conventional treatment, but also Ruqya as well.
Okay, we have the next question from Sister Nawaz. She asks, are we accountable for things we do when we are in anxiety or depression?
Interesting. But again, it depends whether you lost your head completely. I mean, it's what they call in criminal law, I think, diminished responsibility. Again, this is a thick question, and again, it's very difficult. One can say, "Oh God, I was anxious, that's why I did that." But I mean, but if you are, it depends on the level of anxiety. I mean, did you have diminished responsibility at that time of doing something haram, for example? If it is, then I would have faith, that you'll be okay. But again, Allah knows best.
Okay, next question is from Brother Firas. He asks, how is it possible to get rid of after effects of jinn possession, such as false beliefs and waswasa?
I think sometimes, like I say, you have to have a combination of both treatment, but it's very rare where people have both. I think even Dr. Bilal Phillips would mention that people, in fact, most of the people who present to imams suffer from delusion rather than jinn possession. Now, the question was about. So, can you repeat the question again?
How is it possible to get rid of after effects of jinn possession?
I really don't know. I think that you should get I'm not an expert on it, but I would think, it's not something you do once. I think you have to carry on doing ruqya or you do it yourself. But it's not something that you can do it once. And like I say, it's best off an imam probably have better knowledge on that than I have to.
Right.
Sorry.
And Sister Mahmouda asks, Doctor, what's your opinion about postpartum depression and postpartum blues? That's one topic I'm passionate about and would like to help our community with.
Yes, I mean, it's very, very common, and people go through it. Sometimes they come out okay. Some of them, it may affect them 1 year later. And in fact, we have a talk on this, in the conference anyway. And but it's a very common. Again, it depends. Some of them are purely neurotic and can be treated very quickly. Some people go into psychosis. This is where the danger is, because they may harm the babies or they may harm themselves. And this is where you have to. But most people go through the stuff neurosis bit anyway, and then they get over it. Again, I think probably nowadays you tend to be on your own. The family is not there. The mother is not there, and if you live in the West, you're on your own, and lack of support. And I think all these play a very important part. In fact, social support is the biggest ingredient in this in positive outcome in terms of mental health, right? And lack of it creates a lot of problems.
Right. Okay, Brother Ofaruk asks, I cannot concentrate. Is it some mental disorder?
It's not, you can't just one symptoms and try to diagnose something. It's very difficult, and I wouldn't do that either. But I mean, there must be, one need to do a proper assessment, and and to find out whether there's, you just have one thing doesn't cause. There's no one single factor causation. There's always sometimes a multiple causation, or sometimes interrelated factors. So I couldn't be answered that. Maybe not. But we need to find out what other symptoms you have before be able to make some sort of assessment of it.
Sister Sahara asks, how can you tell if a child has a psychological disorder?
The behavior, I was at say in the beginning, you know the child, you know your child better than anybody else, you know how they behave. They may have problem at school, they may start having, bedwetting, they may be irritable, they may be bored at school. I mean, you have to know, which means that you look at the behavior before and look at the behavior now, and try to see if there's a difference. If they're different, then there's something wrong psychologically. Because, sometimes children are bored at school and they become, aggressive and distracted and hyperactive, and, or they sometimes, they problem the family itself, and I always believe that, sometimes the child, I'm not saying in your case, sometimes the child, carry the symptoms of the family. So it's not the child that's unwell. It's not the child that is ill. In fact, it's the family that's ill. That's from my experience, And that's when I see clients, I always like to see the family, because without the family, you don't understand the dynamics between the different people. But like I say, in most cases, one person in the family carries the burden of the rest of the family. But again, I'm talking generally there, but in your case, but like I say, for you, find out whether their behavior have changed. If they have changed and they are getting worse, then there's something wrong.
Sister Naziha asks, is Islam not enough? Why do we need psychiatrists or psychologists?
Yes, quite right. You're quite right. In fact, I read a long time ago that as Muslims, we shouldn't suffer stress at all. Because if we do our salat, we focus on nawafil, we focus on dua, we read the Quran, we shouldn't have high blood pressure. We shouldn't have stress at all. In fact, nowadays, I think it become like a buzzword. Somebody was telling me the other day. I went and did a talk in one of the Islamic society, and they were talking about a child saying that he's stressful. A child of 6, I think. Talking about how stressful he is. So again, it's become part of our language, and you're quite right that as a Muslim we shouldn't be having stress. If we do
there's a question which is actually sort of related to what you just said, Dr. Rassool. The question is from Sister Kamal. She asks, how much is impact of modern day life on causing illness?
Of course, I mean, this is the problem. I always thought that the West industrialized. I mean, go back to industrialization, and we in the East, all right, or South, we never learned from the mistake that the West did. Yeah, and we copy exactly what they did. Of course, once we start industrialized, different things change. More divorce, more suicide. Okay, perhaps before people were hiding it, I accept that. But nevertheless, if I have more divorce rate, more problem abuse, sexual abuse, all sorts of abuse, and you have more problems. So in a way, the more modern we become, the more materialistic we become, the more we're having social, economic problems. Again, we have left the foundation. We've left the basic. We should all go back to the Quran and Sunnah. This is it. This is for Muslim. This is our life. This is our foundation. This is our qaida, really, and in the sense that our base. And so anyway, we need to go back. But more and more, we're getting acculturated. We're taking Western values, living in different society as Muslim in Canada or Northern Hemisphere or Australia, and more, we're getting identity conflict, and we have left. For me, I think we have moved away from our base, from the Quran and Sunnah.
That will be all the questions that we'll be taking for now. We've run out of time. Jazakallah for Dr. Rassool for sharing your expert knowledge with us on this very crucial yet much misunderstood subject. We will now take a break of 10 minutes and inshallah resume after that.
Okay. Jazakallah. Assalamu alaikum.
Wa alaikum assalam wa rahmatullah.